Good morning and welcome to Viva Cafe con Leche. We are together this morning. So for those of you that are watching, I already know Michelle's going to say is that we're throwing her off because we're on the opposite sides of each other. So good morning, everyone. I am the Badass Buddha, Dr. Lori Monaco with Align Yourself, Inc. I am your authenticity teacher, speaker, coach, chiropractic physician, and your fat eviction specialist. Good morning.
Good morning. Buenos días, mi gente. Aquí con la Margarita, your writer, author, artist, magically orgasmic goddess in awe of herself. Namaste and welcome to Viva Cafe con Leche.
And good morning, Tiffany. Good morning, Louis. And while we were getting ready, I noticed that my head, we were sitting in the same lineup, it's not even like I'm in the foreground, and she's in the back. And my head is so much bigger than Margarita's. So this is and she said, what did you say? Your cousin said you have a pediatric.
No, my friend said I have a pediatric head. But then now her saying that's making me feel like the guy from Beetlejuice when they shrunk his head when they were in Hell's waiting room. Good morning, Stephanie.
Good morning. Good morning. Yes, Louis noticed that we switched sides too. Yes. So this is my better side. So
because you see, she's like, oh, they're gonna say we're throwing them off, but she never said let's switch sides.
No,
so now we know the true reason.
Not at all. Absolutely,
that's her best side.
And we get to see your side too, though, with your shaved head. So cool.
In my grays, I'm gonna have all of this white and then everything else black because I'm cool like that.
Yes, she is. You are like the coolest ever. I want to be you when I grow up. So good morning, everyone. And oh my God, never mind. I'll wing it. Don't worry about it. But good morning, everyone. And today's going to be a really fantastic conversation because we're going to be talking about heart health, but especially most significantly, the disparity between women of color and women and Caucasian women and women in general. So we're going to start with the conversation in that way about women in general. And it's not that there's an unequalness with men and women for treatment of heart disease. It's that women are still not quite aware of the fact that heart disease is a really important consideration when it comes to health for women. We always think of breast cancer and things like that. So we're going to talk with our guest, Karen Sammer, about that today. And but before we get going, coffee. How's your coffee this morning? She's drinking my coffee. What did I say it was the last time? I don't even remember what it was called.
Red Barn.
Red Barn. It's pretty good, though. You like it?
It is. I have no sugar in it. I have some organic Ceylon cinnamon, which is good. So it's good. Chanel Dio says, good morning, beauties. Kimberly Matame says, good morning. Stephanie says, you are the coolest. So what's happening with all of us today? Maggie Ramirez, buenos dias, good morning. My sister said, good morning, ladies. You both are
good
beautiful.
Morning, Connie.
Connie. Chanel, let the gray shine. That's it. Only on this side, though. Okay, we're not going to be fully accepting of it. Linda McBeal.
Linda McBee.
Sorry. And
Francia, good morning.
Kimberly said, laugh my ass off at not Bustelo. Good morning, Iritza.
Yeah, the white girl hasn't switched to the to that high test coffee just yet. I don't. You know what? The other day though, I was at Stop and Shop and I was looking and I'm going because I knew because you were in town. I'm like, should I just freaking get it? But if I get it, you're gonna have to make it the way you make it. Like I'm gonna have to put you up into the kitchen and you're gonna have to just make it the way that you make it. I'm so excited to taste it that way.
We'll see. Good morning, Talia. My niece is on. That would be wonderful to foam it and all of that good stuff. Before I leave, you have to have a cup of my coffee.
That sounds good.
So yeah, I started putting pink salt. Oh, the Himalayan pink salt. I like that. She loves it too. So that's good. I was going to say something.
That was such a simple thing to add too, because
just a pinch.
I'm blown away at how that takes away the bitterness. because I really can't stand bitter coffee. That's the thing. I think that's always been the little piece that I've disliked about coffee. Of course, it does depend on the brand, and it depends on how you make it, and there's so many factors. But that little piece right there, so simple to just put some salt in there and cut that down, so it makes it so much nicer.
But do you know that the reason it's bitter is because it's old? Because by the time the coffee gets roasted and then it gets grinded in such a mass production and then sealed and shipped out to all these grocery stores, by the time we pick up a brick of coffee off the shelf, it's 3 to 6 months old already. And coffee loses its essence and its flavor like in 3 to 6 weeks after being grinded. Roasted could last as long as you don't keep opening and close it. So let's all think about purchasing a coffee grinder. It might serve its purpose for you in the morning show in the future. Also, before we get into the intentions, I want to remind everybody that Thursday the 6th at 6 p.m. at 1123 Main Street, I will be doing my first Soul Searching for Peace book reading and book signing at the Collab in Bridgeport Collab in Bridgeport. So I guess all the information's on my social media. But it'll be great if you own the book, if you own the autograph copy, come in and listen to me. Flow with it. That'll be beautiful. If you own the book and you bought it from Amazon and you want a signature, come in. I will sign it for you. If you don't own neither, come and buy one. Let's just go with the flow and enjoy each other's company.
I've been listening, but I'm also typing at the same time. Did you say that you're also bringing artwork or no?
Yes, I will be bringing some art pieces for those who like my art. I'll have a couple pieces. And they'll all be different, probably mostly abstract and one kick-ass bitch of menopause. I haven't decided yet because I'll be up one day till like 4 a.m. just painting because that's how it is. It's that whatever inspires me at that moment. And I'm really trying not to continue to be like that because I should be planning and having it done, but then it doesn't flow right because I started painting as a form of healing. So I can't just say, oh, you want a painting? And then go to it. I'm not Picasso. I am Margarita, the one who flows with the wind.
I don't even know if Picasso was really like that, though, right? Because Picasso just did his own thing. It was
but he painted and painted. That was his full-time job. Really, his full-time job was his passion.
But it was, but like the other one, Da Vinci, right? Da Vinci's the one that did the Sistine Chapel.
No.
Who was the one that did
Michelangelo.
Michelangelo. Oh my God. Isn't that terrible?
And
yes, I know history.
He drew it. He didn't paint it.
But they were hired, like those guys, especially Michelangelo, maybe not so much Da Vinci, but they were hired artists, like, or especially Michelangelo. Like he would just be contracted, So that's a completely different art form. But listen, this is really important, for a couple of reasons. Number one, all of you that are local, you have been, you're the tribe, and the tribe supports the tribe. And it would be really great if you could all come out and hang out with us. I'll be there. We're going to be filming live.
Yes, I was waiting for you to say that.
Yeah, we're going to be filming live. We're going to be interviewing all of you. We're going to be posting, what Margarita is going to be saying from her book. And it's going to be going on for hours, like a couple of hours straight of just back and forth. So it's going to be streamed to YouTube and Facebook simultaneously. And but it would be great for you to get on camera and just talk, and get interviewed and just, have your 5 minutes of fame, right?
Yeah. On Viva.
And, the other thing too is that it's like, it's time for us to get out and like mingle. We are at that point. People are, Connecticut is starting to open their doors and let things come back into play. And we need to connect, in person again, because it's really been challenging for everybody. I mean, this has been a phenomenal connection and we are not going to stop doing it this way. But my gosh, if you are local, definitely come out. And if you're not local, watch, because it's going to be a lot of fun.
Yes, we will be. Viva will be streaming live Thursday morning and Thursday evening, May 6th. So mark it on your calendar.
Yes, exactly. All right. So, you want to do your intention while I keep putting up
Sure.
these?
Intentions for today, mi gente. The question is not what can I accomplish, but what do I want to accomplish? It's called the paradigm shift. Not what can I, because the possibilities are endless when we put our minds to it. So it's not what can I accomplish, it's what do I want to accomplish. That's the intention. Make a decision and flow with it. Go with it. Go with it hard. We can't accomplish anything. I can accomplish redecorating a house and whatever, but what do I really want to do with that time that's going to propel me and push me forward and closer to my goal and my dream?
Beautiful. And especially the fact that you said a paradigm shift. So actually, that could be part of the conversation this morning. So let me just say the mantra, and then we'll mention about paradigm shift in our conversation today. So the mantra for today is I am health. I am health. I think I've used that one before, but this is really appropriate, especially for today. I am health. If you believe that you are health, meaning healthy, strong, in good shape, physically, mentally, emotionally, physiologically, then you will be those things. And if you are not those things, you'll be more aware that you're not, and you'll take action. So I am health. Okay. And so paradigm shift is a really good conversation, because paradigm shift is where you are thrown into a different direction, where you were thinking one way, and then all of a sudden something was presented to you where you completely shifted your perception, your idea, your judgment to a new potential. So I know I've said this story before, but it's such a poignant story that I learned it so many years ago when I was in chiropractic school, because in my school, we had to take philosophy classes. That was part of the curriculum, which back then I didn't appreciate, but I definitely appreciated as I got older. So the story goes like this, and I'll make it quick. The man is on a train. He's coming home from a very hard day of work. He's very tired, and he just wants to come home. And he's sitting across from a man who's just slumped over, looking down at the ground, while his two children are terrorizing the train. They are just running all over, knocking into people, screaming, yelling. And the man is tired. He's like trying to ignore it, but these kids are running around so much, and they're hitting him and knocking into him as they're running by, and he's getting angrier and angrier. And he's watching, and he's so annoyed that the father's not doing anything about it. So finally, he takes as much as he could take. He's trying to ignore it. He can't do it anymore. And he gets up, and he's all mad. And he pokes the guy, and he says, excuse me, aren't you going to do anything about your children? They're running all over the place. You're not stepping in, doing anything. And the man continues to look at his feet. And the guy says, aren't you going to do something about your kids? And the man looks up at the other man with a blank stare, and he says, I'm trying to figure out how to tell them that their mother just died. And that, to me, I remembered that story from all those years, because that is a paradigm shift. It's that moment where you think you know something. He goes up with the idea of this man doesn't discipline his children, right? And he goes to say something, and then he realizes that it's not that the man can't discipline his children. He's not in a headspace to do it, because he's thinking about how devastating the news is going to be to his children. So it's paradigm shift is getting you to see things from a different perspective. And that's what this conversation is all about today, to open your mind up to what if, or this needs to be considered. And the only way to make change then is to become aware of what's not right. And then we start with change within ourselves, and then we spread it out, and we educate people around us so that they make the change. And then it's all good, right?
It's all good. At the end of the day, you have to make yourself a priority. And if you don't know, then learn. Seek. Abel Antonio, good morning. Ira's grandson wanted us to say good morning to him. Good morning, Gwen.
Good morning.
Okay.
We're getting there. I'm sorry. I'm just getting all these people on. It's a little bit challenging sometimes. We're going to have to hire at some point somebody to do this, because it's hard to keep track because we have so many people coming on now, and we're so thrilled.
Yes, we're excited. Good
Yes.
morning, Lillian, Nancy Green, Gwen Lord.
Michelle, did you get Michelle?
You are allowed to be in that shift. No, I didn't see. Oh,
Michelle
Michelle
Iman?
Rivera. Good
Mhm.
morning, Michelle.
Yeah, we haven't seen Michelle Houston on, so that's a little odd, but we'll see her soon. Okay, I think we got everybody for now. So it is, what time is it? It's 8:16.
Sonia Rodriguez. Good
Oh,
morning.
I didn't see Sonia.
Carmen
And
Nieves.
Carmen. Oh,
Coffee bar
Carmen.
and live Viva at event. Absolutely. That's right. Coffee bar. So where you will be interviewing with the Badass Buddha will also be a coffee bar set up for hot coffee, and you can make your own iced coffee and just some little finger dessert foods. Nothing big, but the coffee bar will be set up right where the Badass Buddha will be sitting, so you can make your coffee and sit down and tell her how it is you like your coffee, because Viva is all about café con leche.
Am I making them the coffee or just
No,
self-serve?
no,
Oh, okay. I
self-serve.
was going to say, I got to interview. I got to
No,
make,
it's
I'm a
self-serve.
barista all of a sudden.
Good morning, Arlene Gonzalez. Hey, don't knock a barista. I'm gonna become
No,
one.
listen,
just to
I'm
learn.
not. I was just gonna say, like, I could sit there and do an examination on a person. I don't know how to make a fucking cup of coffee like the way they do it there, and then you see them. So on our Instagram page, we have a lot of coffee houses that we've connected with, right? And they're always showing their videos of their little designs with their, I'm watching this going, how do they do that?
I don't know, but I'm gonna learn.
It's like all this like cool.
You think
stuff.
I'm not kidding you? I will be working part-time somewhere in Florida as a barista just to learn all of that. They offer a training, but I don't think 4 hours in a 4-hour class is going to train me on that, and I need to perfect that.
Listen, here's what I want you to be able to make with your froth, and agree with me on this, tribe. I want you to make the power of pussy. Like, I want you to make a pussy out of froth. Oh my God, I think you'll be the most popular barista.
And put glitter on it, the sugar glitter. I don't know. Let's try it. Doesn't hurt to try. Doesn't hurt, especially not to try new things.
That's right. All right.
So, mi gente, let's stay tuned, because this conversation is imperative to we women. And I think we always need to be aware and alert for ourselves and listen to our bodies.
Yes. So
I think the most important thing is to listen to your body, whether you get a rash that you never had in a certain place. And so let's welcome Miss Karen Sammer, who is awesome. She is just totally awesome. So you're gonna love her. Michelle,
and
good
Michelle's
morning.
On. We are waiting. So let's get Karen on. Here she is. Yay! Good morning, Karen.
Good morning.
Good
morning. Can you hear me okay?
Yeah, yes. You sound great. You sound great. So there we go. And there we go. So welcome, Karen Sammer. And you look absolutely fabulous. I forgot where are you right now? What state are you in?
I'm in New Jersey. I'm in Ringo's, New Jersey.
Tri-state.
Yeah.
You're in the tri-state area.
Yeah. There we go. We're cut off. Okay, there we go. All right. So Karen, first tell everybody sort of like your journey, like how did this become such a big part of your life? And, especially it's not about, you don't just educate people or women specifically on heart disease and what to look for. But you also have taken up strongly the disparity, the unevenness between Caucasian women and women of color. So first start with your original journey, why this happened and where you go, and just take it away, Karen.
It's all yours.
Yes.
Thank you, ladies. Good morning. And thank you so much for giving me this opportunity to talk about this huge and hugely important topic. So back in 2009, I was diagnosed with breast cancer, and I was living the dream. I was 150 pounds overweight. I was, I had high, my numbers were going up, my cholesterol, my blood pressure, my sugar numbers were unbalanced. And so I found out I had breast cancer. I went through a year of treatment. And in that time, I lost 135 pounds. And I did that intuitively. So I really just listened to what my body needed. First time in my life I ever paid attention. Imagine that. and then I decided that doing this, I wanted to teach other people how to do it. So I went and I became a certified holistic health coach. And then beyond that, I went and became a certified nutritional consultant. And then, so I started my practice, and I was really kind of helping anybody I could help. I didn't really have a narrow niche. So then 2017, I was sitting in a meeting fortunately in my local hospital. I was at a Toastmasters meeting, and I sat down, and all of a sudden I started to feel this burning in my chest. And it was uncomfortable, but it wasn't terribly painful. And the fact that it was, like I thought I could kind of wiggle it out, like I thought maybe I pulled a muscle or something. I didn't know what the heck was going on. So, but then it started to radiate out to the tops of my arms. And once that happened, I thought, this is something that needs to be looked at. So I asked somebody to walk out with me, because I was afraid that if it was something serious and I passed out, now what happens? So the guy that was sitting next to me walked me out. We found somebody who worked at the hospital. They took me over to the ER, hooked me up to an EKG, and I was sure enough having a heart attack. So then they took me to the cath lab, thinking that they were going to place a stent on a blocked artery. But what they found was that I was having a spontaneous coronary artery dissection. Oh. Yeah. And so that meant that an artery in my heart.
Explain what a dissection is to people.
So an artery in my heart split. It's 4. And it caused a flap to come down. So your arteries have 3 layers. And this inside layer broke off, came down, formed a flap, caused the blood flow to be blocked. And that's what caused the heart attack. And fortunately, this interventional cardiologist recognized what he was seeing, because it's a rare phenomenon, what happened, and not everybody recognizes it. And sometimes they can do more damage than help if they take the wrong action. So he realized what was going on. He pulled that catheter out, didn't place a stent. It did heal on its own, and he didn't do any further harm. That could have happened. Now, some people who have SCAD, it's called a SCAD. Some people who have a SCAD do require stent placement, but mine did not.
That's good.
So what that actually did for me is, once I healed from that, I became friendly with my cardiologist, and she thought that I would be a good candidate to become a women heart champion. So she sent me to the Mayo Clinic to be trained to be a women heart champion, which Women Heart is an organization that is in support of women living with or at risk for developing heart disease. I became a women heart champion community educator. So now I get to go out and I do things like this. I talk about women and heart health, because so little is known about it in the general population. And we are not just men with uteruses. We are much different physiologically. So it's really important to understand that our symptoms could be different, our risk factors are different, and how we're treated in the medical system, as you were mentioning before, is often different, especially if a young, fit woman shows up in the ER having a cardiac event. She's 7 times more likely to be sent home from the hospital while that event is occurring, often to her detriment, often to die. So it's so important to understand what's going on in our bodies and to advocate for ourselves. And if we're not in the position to be able to advocate for ourselves, hopefully somebody's with us who can. But
so let me just jump in here. So I agree with you. This is something that I have taught for years when I was teaching full time, and when I was teaching the pathology class, I would say that to the students all the time. I would say, you've got to educate yourself. We live in a society where you can find out all types of information. The internet, it doesn't always have to be accurate and truthful, but you can find out anything if you research it. And when you go into an emergency room, you have to have some background in what's going on, or medical or anything. And if you don't, get somebody that does, because, and I'm not judging here, there's a lot of reasons for why this happens, but so many things get overlooked in the ER or even on the main floors. It's partially that they don't have a lot of time. They're always rushing. But they also don't sometimes really want to hear what you have to say, or they ask a question in a way where the person only gives them a partial answer. So it's a combination of miscommunication on both sides. Mm-hmm. But I think there's a little bit more blame on the other side. I have to admit, just from experience, meaning the medical side, because there's still this element of they're always rushing. They always believe they know more. They don't really take the time to listen to what the person's saying. They don't think outside the box. And so it's really, really important for you as a patient or a friend or family member of a patient to go in there armed with knowledge and questions. And if you don't know, just have a list of questions. And that's definitely going to make a difference.
Mm-hmm.
So go ahead, Karen. I'm sorry.
That's okay. No, it's absolutely true. Everything that you said is absolutely true. And, a lot of doctors have a God complex. They know more than you do. And if you ever do try to tell them something, you might be cut off. And if you're already feeling a little uncertain in the situation and then somebody tells you that you're all wet, you're going to stop talking, right? And that doesn't necessarily go well for you. But if you're seen by a female doc in the ER, anybody, men or women, if you're seen by a woman doctor, you are twice as likely to survive an ER visit than if you see a male doctor. And
that's an interesting statistic.
It is.
It is. Yeah, it sure is. And, I know that we're focusing here on women of color because women of color are particularly marginalized. And I think I was thinking about this and I was doing some research, and it's really, if you think about the demographic of people who live in low income areas or underserved areas in cities or wherever, it typically, almost overwhelmingly, is occupied by people of color, right? Those particular areas. And so they're underserved. They're often under tremendous stress. And we all know that stress is a huge contributor to heart disease. Huge contributor. They are probably underinformed. They don't know what's going on in their bodies. They may be eating badly, making poor choices for nutrition. A standard American diet is going to kill everybody who's going to eat it.
Oh, absolutely.
Yeah.
And then factor in lower socioeconomic, trying to buy as much as you can with $10.
Exactly.
Like,
and it's not going to be organic fruit.
Yeah. Exactly. That's what I was just about to say, that organics, right? It's like you'll pay like $100 and you come out with like this amount of food, and then but $100 go a long way if you're buying the cheaper stuff.
And that's why there's so many bodegas and Family Dollars and grocery stores where they can just catch a quick can of SpaghettiOs and that all sugar cereal and no fruit and no fresh vegetables.
Right.
So
exactly.
Continue. I'm sorry.
That's okay. No, this is all part of the story, though.
It's like a setup. It's like a setup for.
I agree with
you. That's 100%. Yeah, I agree with you 100%. I think that it absolutely is a control mechanism. I sound a little conspiracy-like, but
that's fine. Join my party.
You're in good company.
Join my party.
But I do think that it's a control mechanism to keep people poor. How are you gonna not be poor if all you're getting is refined carbohydrates, and you're not feeding your body the way it needs to be fed? So you're under a huge duress. You think about these moms. So if we're talking about women of color specifically, you have moms, often single, often with multiple children, often with low income. So either they're working multiple jobs or they're just trying to scratch by with very little money. And now you have to have that conversation with your son. That conversation where when you go out in public.
See us, Karen?
Oh, there we go. Woo!
Okay. Here we go. Popped up like slut magic, Karen.
But you have that conversation. So you're constantly worrying about your children, your son's going out and maybe not coming home. So that underlying stress, that constant just uneasiness in your life, that takes its toll on your cardiovascular system and everything else. I mean, it certainly causes all kinds of problems. You have a high incidence of high blood pressure in the people of color community. Probably, very much attributed to the lack of the lack of access to good food. They're eating processed food. They're eating fast food because fast food's cheap. You can probably go through the drive-through and feed your family for $20, I guess. I don't know.
Yeah.
I mean, I haven't done that in years. But all of that has a lot of salt a lot of refined, it's refined carbohydrates, all of that, that all contributes to high blood pressure, high cholesterol,
And diabetes.
And diabetes, absolutely. And they are all contributors to heart disease. And they're all manageable through lifestyle and nutrition.
Well, and that's the irony. So statistically, like when you actually look at statistics, you'll hear things like, so when we're talking about heart disease, diabetes, when we're talking about people dying of heart attacks, strokes, kidney failure, complications due to diabetes, there are certain the genetics play in. So they'll say, and the groups that are higher, and it's no coincidence to me that the groups that are, quote, higher genetically speaking are also lower socioeconomic overall. So they're saying African American population, the Hispanic population, Native Americans, Eskimo Native Americans, Pacific Islanders, right? They're all, so, and all of these groups were people that were considered were always thrown the worst. Like they always had the lowest amount of income coming in. They've always were like given the worst foods. And so when I think of it and I say, to me, it's like, how does that even work if it's genetics? How does that work? So like, how does that work? So that means that people that live in Africa, like people that are there, they have a higher level of diabetes and heart disease. And that's not the case.
No, they don't even have skin cancer and they're near the equator. But African Americans in America do because they wear sunscreen.
Yes.
And Africans in Africa do not. And they're under the sun all freaking day.
Yeah.
So the U.S. does, and in Francia, I agree with you. She says it's a system to keep, I guess,
us undereducated, poor, sick to profit of
us.
Because it's not healthcare, it's sick care.
Yes.
Yeah.
Because you don't make money off of people. And I'm saying this very, I want to be really clear about this because, chiropractors are notorious for being anti-medical. I'm not anti-medical. I'm not that type of chiropractor. If I cut my foot, I want to go into the emergency room and I want to get somebody to stitch it up. And I want, I want to get what I need. Okay. Our emergency care system overall is very impressive in this country for specific things, certain things, whatever. It's our long-term care. It's our education of people saying this isn't okay to eat this, or let's do it. And what they do is they do a half-assed job about it. They'll say, well, you really shouldn't eat that when they're already like inundated in it. The habits are already set up. It's second, third generation of cooking this way, of eating this way, not saying this is why you need to do it. This is what you need to prevent. And but again, they will not make money if people start taking charge of their health.
Exactly. And you're right. It is a sick care system. And I think it's a symptom care system, actually.
Yes.
I think that we'll throw a pill at it. And a lot of people are perfectly happy to take the pill than to change their lifestyle, because changing your lifestyle requires action. Taking a pill is a very passive activity, right?
And because they believe the doctor, so they don't do the research on it. And I think you're right. And Francia says that, but that we're showing more and more that we can beat the system by educating ourselves.
Right.
And that's where people like you, Karen Sammer, come in, because I think it is. And then Bud, listen to what she said. If a fit younger woman goes into the emergency room, they will send her ass home to die.
Mm-hmm. Yeah, they'll send her home with a prescription for anxiety or something. Mm-hmm. Yeah, and that doesn't happen every time. It may be that you get a doctor that's paying attention.
Right?
Yeah.
Don't you agree?
Yes, absolutely.
Well, and especially because when it comes to heart, vast majority of heart attacks will be seen on an EKG, and it is nothing to hook somebody up to an EKG. It is fast. It is non-invasive. Yeah. So it's like, why would that be? Like, just do it. Like, to me, it's just do it, see what's going on. And then at least that just starts the conversation,
But sometimes it doesn't show up immediately.
What's
going on doesn't show up immediately.
It can, though.
Yeah, I agree. That most of the time it can. And troponin levels don't go up right away. So if they check your troponin level, that's the enzyme that increases when you're experiencing cardiac damage. Well, if that doesn't go up right away, and they don't keep you hanging around for a couple of hours to test it again later, you may be again sent home. If it doesn't show up on the EKG for whatever reason, because mine did show up on the EKG. but mine does not currently. Not like when my cardiologist hooks me up to an EKG, you can't see that the damage is there because it was small. So I was very grateful. I'm very grateful. I was very blessed that didn't happen.
Well, I'm grateful that that small thing did happen to you.
No,
because that's who you are today. Like that was you were on that one section of the purpose of your life, so that you can be here educating women of all walks of life, of all color. And I think that's what people need to realize. When stuff like this happens to us, it is for a purpose.
Absolutely.
So you're either a victim or you're a victor, and be that guardian angel for those who are still not in the understanding lane.
That's why I do things like this. Is I want to bring this information out because we're not taught this stuff. We're not, and we're taught that a heart attack is, like it's like a Hollywood. I call it the Hollywood heart attack. And they pass out and they're
Elizabeth.
That one, yes, exactly.
Well, so you know what? So why don't Karen? That's actually a good segue because I was actually going to say that. So tell the tribe. Tell the tribe the quote common symptoms that everybody thinks of, but then talk about the actual, like what, especially because women shows up very differently, especially in the beginning. So talk about the common symptoms and then go into what actually is happening more often than not.
Okay. So we know about the elephant on the chest feeling, the pain down the arm, maybe a pain in the left side of your jaw, your left arm, pain in the left side of your jaw. But often women will show up so I had two after. I had one that took me to the hospital and one after I got home, and it showed up as a pain in my neck. So no chest pain, just pain in my neck. But but for what people would expect to happen, it's usually the left arm pain, the jaw pain, the crushing chest pain, maybe profuse sweating, maybe passing out, that type of things. Maybe some indigestion, but along with like that pain. But what really happens, especially in women, is sometimes it can be a pain in your side, in your right side. Sometimes it can be a pain in your back. With me, it was a pain in my neck. It can be pain down your right arm. It can be indigestion, like a feeling of indigestion. It can be a feeling of extreme fatigue. I never lost consciousness. I didn't break out in a sweat. I didn't have extreme pain. I started to have more pain as the night went on when that happened, and it went up into both sides of my jaw. But initially, I did not have much pain. It was burning. It was unpleasant, is all it was. I wouldn't, that's as significant as it ever got, in the beginning. And then, but I know women that have had no symptoms, and they go to, and if it's a mild enough heart attack and you have no symptoms, it's found on an EKG subsequently, and you're like knocked for a loop because you had no idea it happened. But as women, oftentimes, so sometimes we're our own worst enemy, right? Because we ignore what's going on because say again. I'm sorry.
Most of the time, we're more than not.
Yeah, exactly. Because we're so busy taking care of everything else.
Yeah, because we're too busy.
Yes, exactly. And if it's not showing up as a significant debilitating pain, we're going to kind of brush it off. Like I tried to. I tried because first of all, I didn't want to make a scene. That's another thing. We don't want to make a scene.
Oh my gosh. Yes. Thank you for saying that. We don't want to be embarrassed. We don't want to let everybody.
What if it's nothing? Yeah. What if it's nothing? Well, what if it's something?
Mm-hmm.
It's better to go to the emergency room and find out that it's nothing, that really is indigestion, than to not go to the emergency room and drop dead. And that happens too, because women, again, we don't want to make a scene. We don't want to make a fuss about ourselves. We need to get the dishes done, or, our job done, or our kids taken care of, or whatever, whatever it is. It's so oftentimes we kind of get in the way of our own care, right? And so it's really important to know what's going on, or to be able to suspect what's going on. And then when if you find yourself in a situation where you think you need emergency care, don't let them dismiss you. Now, I won't, but it took me many years, but I will not let somebody talk down to me. If I think there's something going on and a doctor tries to dismiss me, I'll either ask for another doctor or I'll take them on. You ain't messing with me anymore, because I just, my life has been threatened twice, and clearly it's not time for me to go yet. I have work to do. And so no doctor's going to get in the way of that.
And if you're not strong enough, like if you're not feeling well enough, then it's important for you to bring somebody with you.
Yeah.
And especially with everything that's been happening, they always have this, you can't go in, you can't go in. Right. That actually is not 100%. You could still have at least one person with you, and you need to have the big mouth with you. You need to have the one that
you need the mama from Terms of Endearment. Give her medicine now. I was that daughter.
Yeah.
Because
I remember your story. I remember hearing that.
And I was like, no, she's not. I said, do you know what's wrong with her? No, but then I don't either. So I'm not taking her home. And the next morning, her heart stopped. She became unresponsive, and they had to rush in and get her up. And I'm that mama. I can't wait for a day where I have to, even if it's for myself, and bang and jump on their thing, because I'll do that too.
And I
want you to advocate for me, Margarita.
There we go. Just give me a call.
Oh my God, the two of you together, the two of those doctors they don't stand a chance.
They don't stand a chance. Absolutely.
And the other thing too is that you also need to have somebody that it's not just about somebody advocating for you if you're too weak. You also need somebody that's not a panicky person. Yeah. That is not going to be just coming across like I don't even know what I'm talking about and start screaming, because that's not effective either. You need to have those people that are like, this is what's going to happen. Like, this is what you're going to do. And ask the questions. Well, what about an MRI? What about a CAT scan? What about this? What about an ultrasound? And just whip out those things in a calm manner and raise the voice when need to be, not just throw out all kinds of stuff, because that's not effective either. Well, you can find those people. You can find those people in your family, but you have to kind of find those people already. Like, you have to already in your head be very aware of who are would be the people that I would call if there was an issue.
Absolutely.
There's two awarenesses that, and I know you're going to end up touching on this. There's two awarenesses here. Number one is that one. So like, if you feel that I can advocate for myself, no problem. Nobody would ever have a problem. Like, if I was in an ER, I just tell it like it is. Like, I've had that happen before. It's not a big deal. But if I was sick enough, I would have to have somebody else step in. So I have to have an idea of that person. So that's one awareness. The other one is the awareness of self. That if you review yourself every single day, every morning that you get up or throughout your day, you pay attention to yourself, your body. It's not just even that. It's just, how am I feeling today? What am I noticing about myself? Where do I have pain? Because yes, your pain was in your neck, but we don't want women to get off this and go, oh my God, my neck hurts today, I'm having a heart attack. We don't want you to panic. We want you to pay attention. We want you to say, well, what's normal? Like what's like, I'll get up, and if I have a little twinge of something, I become really aware of it. And I'll say, okay, what's going on? Where is that? What would be causing that? What did I do yesterday that it could have contributed to that? I will say this though, I have more knowledge than most people. Like, I literally will walk through my body and go, okay, I have a pain on my right side. Is it my liver? Is it my gallbladder? Is it just a musculoskeletal? But I still pay attention to the feeling. And if we become more aware of what is going on with us day to day, then we'll know when something isn't right. Okay, that happened 2 days ago. Like this is where we screw up. When the doctor says, how long has this been going on? And you're like, I don't know.
Yeah.
But again, going back to what Karen said, and I agreed, is sometimes, especially the women of color, are too busy, or they're already set in that mentality that they're too busy. They got to get up. They got to do this to get the kids ready. Whatever they have to do, that they have to be. We have to be reminded and taught how to take out that 15 minutes every morning before the day gets started to even keep a journal. How do I feel today? What hurts me? Maybe I slept wrong, because I'm guilty of that same thing as well. And because I'll have a pain in my hip and I'm like, oh, it's my arthritis. But no, I fell too not too long ago.
Yeah, so it could have been a chip. You could have chipped a bone.
And I fell right on that side. Yeah. So, and you're right. badass Buddha, you're right. We need to pay more attention before the panic sets in. But we need to learn how to carve out, even if it's just that 15 minutes in the morning before anybody else is up. Just
take an inventory, right?
Yes, even if you don't do anything else, take an inventory. Absolutely. Yeah. Good morning, Brenda Lugo. And Tara, I have one question. Tara, I don't want to say your name wrong. Ziogas. She wrote that she had no idea about these signs, Karen, but she also wrote something and the vaccine ...
Oh yeah.
And what did
she said?
Liza wrote something about the food is thy medicine.
Yeah,
no, that's Hippocrates. Yeah.
She said, "Food, you are what you eat."
And then she said, right here,
yeah,
let food be thy medicine,
and medicine be thy food. Yes, absolutely. Yes, but food can either be your medicine or it can be your poison.
Oh yeah, absolutely.
Right.
Absolutely.
I was slowly murdering myself for like
you know what
my life.
So was clearly I was as well. I think that I was complicit in my breast cancer, which is what set me on this path. The heart attack, I'm not going to take credit for because that was a weird thing. And that may have been attributed to the cancer treatment. I don't know.
Absolutely. Yeah. Absolutely.
So, because that's the gift that keeps on giving.
Oh yeah, the chemo. Yeah. And radiation. Absolutely.
All of that. Yeah.
And that's another. There's two extra points here that we also need to quickly fit into this conversation. So women of color, there's. And again, we're not grouping people into a socioeconomic group, okay? Because there's plenty of people that make a lot of money. There's plenty of Caucasians that are lower socioeconomic. It's not what we're saying. What we're saying is with women of color in general, but also more so with lower socioeconomic levels, they don't have the best insurance, and as a result, that quote, you don't have the best care. And I don't care what is said. That is the truth of it, because I've been on both sides. I have been I've had the state insurance and I've had good insurance, and it is different. People treat you differently. Your options are less. People don't question treatments. What are the side effects of this treatment? What is the overall? You're going to treat it for this purpose, but it's get rid of this purpose. But what trade-off am I going to have? What will that do to my body for the long term? And so you have to fight for all of these things, and you have to ask for these things. Just don't make assumptions because, oh, well, they said I had this kind of insurance. Then ask. If you don't like the service at this hospital, go to another hospital. And especially where we live in Connecticut, even in Florida, there's like multiple hospitals in one city. Sure. So you go to this one and try to this one, or, but again, it's also about us taking responsibility for ourselves. What am I putting in my body? What am I, how are my stress levels? And don't assume that the medicine is going to solve all the problems. We have to take accountability. And that's another piece that we don't like to do either. We would rather take the medicine because we don't want to be accountable to our health. We want to blame everybody else.
And so it's easier. It's easier to pop a pill than it is to do it.
It's about having these educational classes readily available in the neighborhoods where these women live.
Right.
Absolutely. Absolutely.
They might not have a car or a ride. We need to do pro bono for those who are familiar with that. Do pro bono in those neighborhoods, because if your end goal is to educate women and assisting them in educating themselves, and we know that they live in a certain area where they can barely afford plant-based foods that are organic and healthy, then do it from your heart. And do a pro bono thing somewhere, or get trained on it for those who train somebody from that neighborhood and have them do it at the local YMCA. And I think that's what we need to start offering. And then comes all the vital information they're going to need to grow old gracefully and be around for their children and their grandchildren.
Yeah. I would love to get involved in a program like that. If you know of any program like that,
well, maybe we need to create it, Karen. I'm here in Florida, you in Jersey, and her here in Connecticut. And I think
I love that. Yeah. Yeah, I think that's an amazing idea, and because it's really so important to understand this stuff, and it's not taught in schools. It's not taught in medical school. Like
No, in
you're not
fact,
getting nutrition information in medical school.
no. And a lot of people don't realize that. There's two things that people don't realize about med school. Number one, medical doctors do not learn about nutrition. If they do, it's a half a term. It's like a half a semester. Okay. Number one. So when a doctor says, "Oh, I had nutrition in school," that's a lie. They didn't have enough.
They did have it,
and
they just weren't
well,
taught
that's
it.
true. Okay. They didn't have enough. And they sure don't look at it that way. And here's another one that's a eye opener for a lot of people. They also don't have pharmacology, but they have one semester or a half a semester. So they don't know medication either. You know who owns medication?
You know what they know about medication is what the pharma representative is telling. Yes, exactly. And if that person's a good salesperson, and they're not allowed to give out incentives anymore. They used to give out incentives.
They get around that, by the way. They get around that.
I worked in pharma for 30 years. Yes, they do.
Yes.
And
but so that, and I always tell people that if you're unsure about your medications, and then the doctors don't communicate with each other, so they don't know what this person's taking, even though we have all this shared information now. A lot of these places share their information. They could easily pull up your records.
Mm-hmm.
So you go to your pharmacist. That's what I always tell people, that just they're the ones who know. And a lot of these pharmacists, I'm friends with somebody who's a PhD in pharmacology. She said that a lot of them now are really stepping up to do the natural, they're doing the nutritional training. So they're not
the pharmacology, or the pharmacists are?
Yes.
Wow,
yes.
That's amazing. Good, yeah.
So she said that they're not just learning about the meds, they're also learning about the natural stuff and how they interact with each other. They're having recommendations because they have PhDs now, because they have that background. Some states allow them to actually hold a private practice where they can consult.
Oh, wow.
Yes.
That's really good. That's great.
It is. It's fantastic.
Yeah, I love the fact that because allopathic medicine is based in pharmacology. It really is. Even though they're not trained really well in that, I mean, they're trained to give out drugs. That's because writing a prescription is a lot quicker than sitting you down and for half an hour telling you what to do with your lifestyle. It's a lot, and then it's an assembly line of.
Michelle Houston even says it's the same with veterinarians, because she's a big animal person, and it's the same. It's the same thing. It's like and it's not a coincidence that our animals are getting all these bizarre human diseases because of the quality of food that we're putting into their body, or we're giving them our cooked food that is crappy anyway, and then we're sharing it with our pets, and then we're wondering why they're getting cancers, and they're getting heart disease, and they're getting their obese liver disease.
Yeah.
It's all still coming back to what we're putting in.
Absolutely. Absolutely. And you made a point before about the generational impact, the genetic impact, but it's multi-generational. And then you made the comparison to Africa. Well, here's the thing. When you are nourishing somebody, a line of family members, or generations of family members, the same bad way, those genetics are going to be changed. If your grandmother ate badly and gave birth to your mother, who also ate badly, and then gave birth to you, who also eats badly, then your children are going to eat. Your children are going to have every one of those generations is impacted by those choices. And so, it is a genetic problem, but the genes are being changed because of the way we're treating our bodies.
Which, before everybody out there thinks, "Oh my God, I'm fucked," then, because we've had 4 generations of bad eaters. If they changed that direction, they can change the other way. Yeah. That's the untold truth. It's not that it's an untold truth. It's just that this is newer research. People are not really hearing this enough, that we have the ability to change our DNA.
Yes. Yeah. And you're not a slave to your genes.
That's right. We are not. And and it's all about, it's a combination of factors. It is what we put into our system. It's also a mindset. People don't realize that you actually start
absolutely
thinking
true.
differently. You can actually set your genes differently. You can turn certain genes, gene markers off. You could turn the healthier gene markers on. So when we were told years ago that it's all in your head, like you can't, it's, they would say the term psychosomatic. Oh, it's all in your, you're getting yourself sick. That was a beautiful discovery, because that's true. Why are we pushing that off? Why are we poo-pooing that? If we're getting ourselves sick with our thoughts, then guess what we can do?
Yeah, absolutely. Did you read The Biology of Belief by Bruce Lipton?
Yes, I did.
I thought so. That sounded like it.
But
I
yeah,
love
you
that
can change
book.
my in my DNA from both my parents, alcoholism and drugs. You know, whether my mom was really a prescription junkie in my youth, but they were both alcoholics. And then my father was more of the street kind. And if I've been drunk 3 times in my 52.5 years, that's too much. Maybe because I'm a control freak. I don't know. But then I come from an Italian mother and Puerto Rican father. So we had arroz con habichuela and some fried meat. And if we didn't have that fried meat, then it wasn't dinner. And if not, you had that overcooked pasta, which now I always prefer al dente. And then you had like the oils from the meats and everything, and the bread. So it's amazing how my body feels with the change, with having the fruits and vegetables eaten together at a meal, and how that makes my body feel afterwards with the protein. So I think it's never too late for anybody, regardless of what your age is. And I just think it's mindset, you know.
Yeah, for sure. That's everything.
Make a decision to eat better. And Lori's been my guide on that part. So I'm really appreciative. When my husband, I had to tube feed him when he was with ALS, I did everything organic, and I blended it, and I would then, tube feed him all the organic stuff. And he never got a cold. He never had a fever. He always suffered upper respiratory infections prior to him getting ALS. That was my biggest fear. Never got it in the 5.5 years that I tended to him as he was paralyzed. And it was because we changed everything. It was less meat. It was more like the vegetables and the fruits. And so
and then I forgot.
Then I forgot. And then, and I went backwards, and then I'm back on track. But you're absolutely correct. Absolutely.
But doesn't it feel amazing when you get back on track? Doesn't it feel like your whole body just, I feel better than I did when I was in my 30s. I'm 6, I'll be 64 this year. And I mean, it's just, it's such a simple but not simple, right? Because if you don't have the knowledge, then of course it's
the knowledge, but it's also habitual. So it is hard. You have to break a habits. And it's not easy, because we often value how we value ourselves, or how we value ourselves on a particular day. So, like Gladiator Guru is, to me, is just, she is such a strong individual. She loves herself tremendously. She has high value. But we all have bad days. I've seen her on her days where she feels low. And when we get to those headspaces, we want to self-sabotage, generally speaking. And one of the best things that we like to do, especially women, is eat poorly as a self-sabotage, saying that's making us feel better, to hit the carbs, the refined carbs, the sugars, the chips, this, and that. And then we feel like crap afterwards. And then we say, oh, I'm not going to do this again. And then we get back on track. And then we feel better. Why do I do that to myself? This feels really good. And then something else hits us, and then we fall off the wagon again. This is why it's important. It's a process. You have to, number one, give yourself permission to do it. Number two, you have to forgive yourself when you have those moments. And you have to also use your tribe, that hang out with the people who are also feeling that I'm done. I want to fix myself. I want to be a better person, a healthier person. Hang out with those people. When you have a moment that you're like, I can't do this anymore. I feel like I want to grab the cookies. Then you reach out to some of these people. This is what I'm stressing about. This is what's going on with me. And little by little, you will switch. For some people, they just switch and they're like, that's it, I'm done. Like, that heart attack was the wake up call. And then from that point going forward, they never looked back, and they never, I teach this. I have the program. I have the tribe, and I still have challenges for myself.
Absolutely.
But that's
Me
the
too.
realization of it, is
Yeah.
to say,
Because
okay,
we're human and we're
We're
gonna
human
fuck up.
beings. Yeah.
right.
And but the thing is, you come back stronger, right?
Yeah, absolutely. But the thing is that those bad habits, or those any habits, the neural pathways for those habits are always going to be there. Always going to be there.
Yeah.
You can make new neural pathways for new habits,
Right.
but newer habits have less of an impact. So it's like if you ride on a highway over and over and over again, the ruts are going to happen. You know, like you're going to get ruts in the highway. Well, if you're using those old habits over and over and over again, you have deep ruts. Well, this new habit comes along, and it doesn't have as deep a rut. So your car is naturally going to go into the deeper rut unless you make a conscious effort to pull it out of that and make new ruts. And so that's kind of how I try to explain it to people when they're trying to switch habits, because first of all, I feel like habits have to go in pairs, because usually you have one habit will trigger another habit. So if you have I always liken it to my old smoking days. If I had a cup of coffee, I'd have a cigarette. So I had to stop drinking coffee if I wanted to give up smoking. And I did. And I switched it to something else. So it's really important to understand what habits trigger other habits, so that you can, you know, if having a crappy day triggers the habit of grabbing that bag of potato chips, first of all, don't have the chips in the house. So
That's
that
right.
it's more of an effort.
Absolutely.
Yeah. And try to find something else that's gonna make you feel better, because the chips aren't gonna make you feel better. And even when you're doing it, those damn chips are not gonna make you feel better.
Well, they do. Let's
In
be
the
real.
moment. In the
For that
moment.
that's right,
Yeah.
because they're literally releasing chemicals that are just,
Absolutely.
but it's all false.
Yeah.
It's all false, because
But it's also manufactured that way.
say that again, Karen.
The food is manufactured that way. The food is made to be addictive.
Oh,
Yeah.
absolutely.
That's another topic, but yeah,
That's
that's
absolutely. Oh yeah, then we'll have you back for that
Yes,
topic.
definitely.
honey, I will be all over that.
Because I like crunchy foods, because I'm an angry little fucker. So when I have my rageful moments, or I'm like really bothered, and whoever I need to address isn't there, because I'm not a phone or text arguer. I like face to face.
Face to face.
And so the crunch of something, like it must be the sound, the feel of the crunch, and the
It's
sound
all of
of
it.
it.
It's all of it.
So now I crunch on celery.
Does it give you the same satisfaction?
Not as much, because it's kind of hard, and you got to make sure you get them fresh and not them soggy ones. So then it's like you got to really pay attention now, but it sharpens the brain at the same time.
Yeah.
Okay, so I'm angry. I'm not punching somebody in the throat. I'm still having something crunchy, and it's not gonna lodge in my hips. So I guess it's a win-win.
Absolutely. Absolutely. And celery is really good for you. It's got a lot of fiber. It's got a lot of other stuff. If you know, the medical medium is a guy who, I don't know if you've ever heard of him, the medical medium, Anthony Williams. Oh, did we lose you? Hello? We're frozen. Oh no. Ladies, you're frozen. I don't know if you can hear me. Oh, that's a bummer.
Hey,
Oh.
my internet went out, and thank goodness you stayed on, because
You know what to
otherwise
do.
it would have ended the broadcast.
Oh.
And then that would have been that. So sorry, everybody. That's this is what happens when I broadcast from my downstairs office. It's sometimes that does that. So, and we didn't want to just leave like that. So we apologize. I know we're over time. So we just want to first off say to everybody that we loved how many people came on today. We had a lot of different people on, a lot of our same crew. It was a phenomenally powerful conversation, Karen. We definitely want to have you back on, and we are booked out so far for guests. However, we're going to put you in on a Tuesday show so that we're not looking at like you're not coming back till October.
No.
Because I think the next conversation needs to be what you had said. It needs to be about addiction.
You left again. Okay.
There we go. We're back on. Okay. We better go before it's just telling us something.
Yeah.
It's oh, you know what it is? It's a conspiracy. It's they're like, oh, we need to get them to stop talking. We don't want them to know the truth.
Exactly. Yeah. Somebody's listening.
As always, I just want to tell the tribe, everybody, thank you for coming on today, and thank you for staying longer. This was a very important topic. Karen, I love you.
Yes,
I love you back.
And
I love you so much. This is great.
And we will get in contact with you, because I think it should be sooner than later for you.
Yes.
And it'll be a Tuesday, so let us know what works for you soon. Because this is something that we need to continue, sharing with the world, because and anybody that's still on, if you enjoyed this, share it with somebody.
Yes,
share it on your page, because it might just reach the person it needs to reach.
And it could save lives. So this is a real, seriously, this is really, really important. So thank you. Yeah, Karen, it's been great.
Yes, I loved it.
So Karen, you want to just say anything last minute before we go?
Well,
how can people reach you too? That's the other thing. Please share that information.
So my website is www.yourpoweryourhealth.com. And there's a video on there. Actually, if you go to yourpoweryourhealth.com/take-control, there's a small video. It's like 8 minutes. It talks about the 5 steps that I use to work with my clients to help them to gain control of their health and lose their weight, once and for all. And so that's the video. And I offer a free consultation to anybody who signs up for one. And there's about
And we're gonna put Karen's contact information in the comments, but also in the description of both videos on YouTube and Facebook. And we again thank you, Karen, so much for coming on. It's been great, and thank you for staying longer and hanging out when you were the only one on on my broadcast. So that's you should have done a little show. Next time that happens, you just gotta
dance. Okay, I'll do that. All right.
And so just to let everybody know, next week is going to be a really interesting week because we're having guests for both days. On Tuesday, it's called Building from the Broken, Acknowledging the Ugly, Accepting It, and then Rebuilding with Olympic hopeful representing Puerto Rico for hurdling, Gabby Scott. She's an amazing young lady. So we're very excited to have her on. And then on Thursday, opening the gates for the Age of the Prophetess with Kira Poulsen. Awesome. And Kira's amazing. She was on Viva After Dark, and she's this amazing spirit. And she's going to be talking about how we as women it's the age of the women. It's the age of the females. So this is going to be a fabulous show next week. And thank you all for coming. We saw so many new faces.
Yes.
We've already heard, Maritza, she said she shared this video already. We're so thrilled that all of you are doing that, and we really greatly appreciate it. So thank you so much for everybody coming on. Have a beautiful weekend. Are you good? We ready to sign off? Okay. So from the Badass Buddha, remember, be you, be real, and be extraordinary.
And I just want to give a shout out to my brother for coming on. Moyeto, I love you. And remember, breathe in the beauty and breathe out the bullshit. Namaste.
Namaste, everyone.
Take care, ladies.